1. Which arterial blood gas or ABG finding is most indicative of acute ventilatory failure? A. pH of 7.45, PaCO2 of 40 mm of mercury, and bicarbonate of 24 milliequivalents per liter. B. pH of 7.20, PaCO2 of 65 mm of mercury, and bicarbonate of 26 milliequivalents per liter. C. pH of 7.50, PaCO2 of 30 mm of mercury, and bicarbonate of 23 milliequivalents per liter. D. pH of 7.35, PaCO2 of 45 mm of mercury, and bicarbonate of 24 milliequivalents per liter. Two. A patient's pulmonary function test or PFT reveals a decreased FEV1-FVC ratio. This finding is consistent with which condition? A. Pulmonary fibrosis. B. Asthma. C. Kyphoscoliosis. D. Pneumonia. Three. Which breath sound is most commonly associated with upper airway obstruction? A. Rhonchi. B. Stridor. C. Crackles. D. Pleural friction rub. Four. What is the normal range for end-tidal CO2 or EtCO2 in a healthy adult? A. 20 to 25 mm of mercury. B. 30 to 35 mm of mercury. C. 35 to 45 mm of mercury. D. 50 to 55 mm of mercury. Five. Which diagnostic test is most appropriate to confirm the presence of a pulmonary embolism or PE? A. Chest X-ray. B. Pulmonary angiography. C. Echocardiogram. D. Sputum culture. Six. Which ventilator mode provides a set tidal volume with every breath, whether triggered by the patient or the ventilator? A. Pressure support ventilation or PSV. B. Synchronized intermittent mandatory ventilation or SIMV. C. Assist control ventilation or AC. D. Continuous positive airway pressure or CPAP. Seven. A patient on volume-controlled ventilation has worsening ARDS. Which ventilator setting should be adjusted first to reduce barotrauma risk? A. Increase tidal volume. B. Decrease inspiratory time. C. Lower plateau pressure. D. Increase respiratory rate. Eight. Permissive hypercapnia is most beneficial in the management of which condition? A. COPD. B. Pulmonary fibrosis. C. ARDS. D. Pneumothorax. 9. A high-pressure alarm on a ventilator may be caused by all the following except A. Secretions in the airway. B. Patient biting the endotracheal tube. C. Circuit disconnection. D. Bronchospasm. (10) A patient with COPD is placed on mechanical ventilation. What initial tidal volume setting is most appropriate? A. 4 to 6 milliliters per kilogram of ideal body weight. B. 8 to 10 milliliters per kilogram of ideal body weight. C. 10 to 12 milliliters per kilogram of ideal body weight. D. 12 to 15 milliliters per kilogram of ideal body weight. (11) Which of the following is a potential complication of high-flow nasal cannula or HFNC therapy? A. Barotrauma. B. Increased work of breathing. C. Decreased oxygenation. D. Hypercapnia. (12) Which type of oxygen delivery device provides the highest VO2? A. Nasal cannula. B. Simple face mask. C. Non-rebreather mask. D. Venturi mask. (13) What is the primary indication for using a heated humidifier in mechanical ventilation? A. Increase oxygen delivery. B. Reduce risk of airway drying. C. Increase CO2 removal. D. Improve lung compliance. (14) Which of the following is the most effective method for confirming correct endotracheal tube or ETT placement? A. Chest X-ray. B. Pulse oximetry. C. Auscultation. D. Respiratory rate observation. (15) A patient is receiving 60% oxygen via a Venturi mask, but their SpO2 remains at 86%. What should the therapist consider? A. Increase flow rate. B. Switch to a non-rebreather mask. C. Discontinue oxygen therapy. D. Use a nasal cannula instead. (16) Which bronchodilator is classified as a long-acting beta-agonist or LABA? A. Albuterol. B. Ipratropium. C. Salmeterol. D. Budesonide. (17) Which medication is most appropriate for an acute asthma exacerbation? Asthma exacerbation. A. Montelukast. B. Salmeterol. C. Albuterol. D. Tiotropium. Which of the following drugs is an inhaled corticosteroid? A. Levolbuterol. B. Fluticasone. C. Ipratropium. D. Theophylline. What is the primary side effect of excessive beta-agonist use? A. Bradycardia. B. Hypokalemia. C. Metabolic acidosis. D. Hypernatremia. Which drug is commonly used to reduce pulmonary hypertension in neonates? A. Nitroglycerin. B. Sildenafil. C. Inhaled nitric oxide. D. Albuterol. What is the primary cause of hypoxemia in ARDS? A. Airway obstruction. B. Ventilation perfusion or VQ mismatch. C. Decreased hemoglobin. D. Hypoventilation. NBRC. The National Board for Respiratory Care, or NBRC, is a credentialing organization that establishes and maintains high standards for respiratory care professionals in the United States. It develops and administers nationally recognized examinations that assess the knowledge and competency of individuals in the field of respiratory therapy. The NBRC offers certifications such as the Certified Respiratory Therapist or CRT and Registered Respiratory Therapist or RRT, as well as specialty credentials in neonatal pediatric respiratory care, pulmonary function technology, sleep disorders testing, and adult critical care. By setting rigorous standards, the NBRC ensures that respiratory therapists are well equipped to provide high-quality care to patients with cardiopulmonary disorders. The organization is committed to advancing the profession and promoting excellence in respiratory care through ongoing credentialing, education, and professional development. Here are 5 top beneficial uses of NBRC. 1. Professional credentialing and certification. The NBRC provides nationally recognized credentials such as CRT or Certified Respiratory Therapist and RRT or Registered Respiratory Therapist, ensuring that respiratory care professionals meet high competency standards. 2. Career advancement and job opportunities. Many employers require NBRC credentials for hiring and promotion. Achieving certification can lead to better job prospects, higher salaries, and leadership roles in respiratory care. 3. Standardization of respiratory care practice. By setting rigorous examination and credentialing standards, the NBRC helps maintain consistency in the quality of care provided by respiratory therapists across different healthcare settings. 4. Specialty certifications for advanced skills. The NBRC offers specialized credentials, such as Neonatal Pediatric Specialist or NPS, Sleep Disorder Specialist or SDS, and Adult Critical Care Specialist or ACCS, allowing therapists to specialize in specific areas of respiratory care. 5. Continuing education and professional growth. The NBRC promotes lifelong learning by requiring credentialed professionals to maintain and renew their certifications, ensuring they stay updated with the latest advancements in respiratory care.